All right, today we're going to talk about a condition that gets brushed off as just morning sickness, way too often. We're diving into something called Hyperemesis Gravidarum, and trust me, it's a whole different ballgame. Understanding what this really is, it's crucial.
So here's what we're going to cover. First, we'll break down exactly what makes this condition so different from typical morning sickness. Then, we'll get into the nitty-gritty of how doctors actually diagnose it. And finally, we'll look at the treatment plan, which, as you'll see, really takes a village.
Okay, first things first. Let's tackle the biggest misconception right out of the gate and get to the heart of what truly defines this condition.
So this is probably the question on everyone's mind, right? Isn't this just really bad morning sickness? And while I get why people think that, the medical reality is so much more serious.
Hyperemesis gravidarum, or HG for short, is medically defined as a severe form of nausea and vomiting. And that word, severe, is everything. It's what puts HG in a completely different medical category than the nausea that many people experience during pregnancy.
And you can see here it's pretty rare, affecting only about 1 to 2% of pregnancies. But you know what? If you're in that 1 to 2%, that small number means absolutely nothing. For those experiencing it, this condition can be completely debilitating and requires serious medical intervention.
So, if it's this rare and this severe, how do doctors make the call? That brings us to the diagnostic checklist, the very specific criteria that help them go from suspecting HG to being certain.
So if this is so much more than morning sickness, how do medical professionals actually make that official diagnosis? What are they really looking for?
Well, this isn't just about how someone feels, it's about hard, measurable evidence. Doctors are looking for persistent vomiting. We're talking several times a day that leads to very clear signs of dehydration. They're also looking for significant weight loss and imbalances in the body's electrolytes. You know, those essential minerals that keep your nerves and muscles working right. And here's a huge one: a weight loss of more than 5% of pre-pregnancy body weight. That's not just a symptom, it's a quantifiable, serious physical impact. It's a major red flag for doctors that something is very wrong.
To confirm what's going on, doctors run a whole battery of tests. They'll do blood work to check organ function and those electrolytes we mentioned. A urinalysis will look for ketones, which is a telltale sign the body is so starved for energy it started burning fat. They'll also do an ultrasound to rule out other things, and sometimes an endoscopy is needed just to make sure there are no other GI issues at play.
Okay, so once a diagnosis is confirmed, the focus pivots immediately to management. And this is really important. This is not something one doctor handles alone. It's a true team effort.
Managing HG really requires a whole team of specialists. You've got obstetricians, gastroenterologists, and nutritionists, all working together, all bringing their expertise to create a comprehensive care plan.
Now, treatment is often tiered. The first thing to try is usually lifestyle modifications. You know, things like small, frequent meals, avoiding trigger foods, getting plenty of rest. But when that's not enough, that's when more intensive support becomes absolutely essential. This can mean IV fluids to rehydrate, replacing lost electrolytes, and in really severe cases, specialized feeding through tube or an IV line. Medication is also a huge part of the plan. You have antiemetics, like ondansetron, which directly target nausea. It is important to note, though, that ondansetron has a controversial history, making it a critical point of discussion between a patient and their doctor. Antihistamines can also be effective, and for the most severe, unresponsive cases, corticosteroids might be an option.
And this quote really highlights just how serious HG can be. Sometimes managing this at home isn't enough. The medical guidance is clear. Hospitalization may be required for severe cases or when complications pop up. This is a critical step to manage dangerous complications and protect the health of both the parent and the baby.
So after looking at all the science and the medical facts, we're kind of left with a very human question. How can a better understanding of HG create more support for those who are going through it? I think it all comes down to shifting the conversation, right? Moving away from, it's just morning sickness, and toward recognizing this for what it is, a serious medical condition that deserves our full attention, empathy, and care.